Welcome, everyone. We're going to give folks a few minutes to join. So please hang out for a few minutes until we get started with this great conversation. And if you are in the audience and have a minute, please go ahead and introduce yourself in the chat with your name and organization. Thank you. I can see we're getting a few more people. We are going to give folks just another minute to join the webinar. And while we're waiting, if folks can introduce themselves in the chat with your name and organization. I think we'll give it one more minute and then we're going to get started. If again, if I see lots of people putting their introducing themselves in the chat, thank you for that. It helps us understand who's in the audience. And if you haven't already, please do introduce yourself via the chat with your name and organization. Thank you. All right, I think we can go ahead and get started. Welcome, everyone. We have a, excuse me, we have a lot to cover today, so we're going to go ahead and get started. I first want to introduce myself. My name is Benjamin Orr. I am the founder, president, and CEO of the Maryland Center on Economic Policy. For those of you who don't know us, we are a nonprofit, non-partisan think tank that believes every Marylander should be able to achieve their full potential in a healthy economy that offers a widely shared and rising standard of living. And I really appreciate everybody joining us for this important conversation. Our moderator today is one of MedCEP's board members. I'm happy to introduce Dr. Siobhan Laird as not only is she a board member for us, but she's also the Director of Community Health Impact for Bon Secours Mercy Health. We will kick off this conversation in just a moment, and I will let you know that we do plan to leave plenty of time to respond to your questions at the end. If you're joining us on Zoom, you can submit them at any time using the Q&A button at the bottom of your screen. Please also note that this webinar is being recorded and you will receive the recording and other materials via email afterwards. With that, I'll hand it off to Siobhan.
Thanks so much for that introduction, Ben. I'm going to turn it over as quickly as I can to the panelists. I would just say that I know that housing and health go hand in hand. We at Bon Secours Mercy Health have been doing this work for 20 years in communities, affordable housing, access to housing, because we are active members of the communities that we serve. And we, as one of many hospitals and health institutions, are recognizing the importance of this connection and the importance of addressing these issues. What you'll hear today are a lot of different perspectives on this issue. I know that there are some unique perspectives that I've learned about as I've had preliminary discussions with these panelists. So I'm really looking forward to the discussion, not just the panelists, but also the folks who are attending today. Looking forward to your questions and the respective answers. So first, let me introduce the panel. I'll start with Joanna Diamond. She is the Director of Public Policy at Healthcare for the Homeless. Her pronouns are she and her. Healthcare for the Homeless, for nearly 40 years, Healthcare for the Homeless has supported thousands of adults and families in their struggle to find safe and secure homes in the Baltimore metropolitan area. As part of their full integrated medical and behavioral health care, Healthcare for the Homeless provides permanent supportive housing to over 400 people every year. Joanna, would you like to say a few words?
Yes, thank you so much, Siobhan, and thank you, Ben, for having me and for hosting this important conversation. And it's certainly an honor to be here with my distinguished co-panelists, so thank you all. I will just say, Siobhan sort of mentioned what the agency Healthcare for the Homeless is about, and I'll just briefly state that housing is the proven first-line response to fixing dramatic health disparities across populations. And as part of the work that we do, we've learned that homelessness creates new health problems and exacerbates existing ones. So this is why we need to focus on policy solutions that both end and prevent homelessness. We are and have been in a housing crisis for decades, and it is the result of a disinvestment in housing. In other words, it's the result of deliberate policy decisions. And there is a complete dearth of affordable housing and wages are too low. And as we say, homelessness is a housing problem, not a people problem. And aside from the cruelty of our policies in the lack of attempts to prevent eviction and curb homelessness, the state can also realize significant cost savings in housing, particularly in the healthcare space. And so when people experience unsafe conditions or are unable to pay their unnecessarily high amount of money up front, they're often forced into homelessness, and this is absolutely unacceptable. And I will just close my opening remarks by saying we absolutely need long-term solutions to addressing the housing crisis in this state, and I absolutely appreciate the ability to be on this panel today. Thank you so much.
Thank you so much for those opening remarks. I'll move on to introducing Ashira Dotson, President and CEO of Eastern Shore Wellness Solutions, which is a community-based nonprofit health education and training organization designed to promote health equity through awareness, outreach, and advocacy. Eastern Shore Wellness continues to be a trendsetter in bridging the gap between communities and the resources and services needed to maintain and produce sustainable supports while decreasing the social determinants that impact health, including housing, transportation, and food insecurity. Ashira, a few words?
Thank you. I too want to thank the Maryland Center on Economic Policy for inviting me to participate in this panel, and all of my distinguished panelists. I just offer up thanks for joining the conversation. And I'll just quickly say, you know, Eastern Shore Wellness, we are a community-based organization, but our passion to reduce the social determinants that impact health, not just here in Dorchester County, but across the state, is what moves our agenda forward. Even though our primary focus is health and making sure that people have quality health and access to healthcare, having those social determinants that impact, like housing, transportation, and food insecurity, play a major role in our community because we're so rural, is what our work is all about, and making sure that, you know, we're connecting people to the resources they need, whether it is adequate housing, whether it is transportation, whether it is to the proper foods that they need to be successful.
Thanks for that, Ashira. I really appreciate the work that you and your organization do as well. Next is Dr. Craig Pollack, who is the Katie Ayers Endowed Associate Professor at Johns Hopkins Bloomberg School of Public Health and the School of Nursing. He's a practicing internal medicine physician whose research focuses on the connection between housing and health. He also works as an advisor on a part-time basis at the U.S. Department of Housing and Urban Development in the Office of Policy Development and Research on issues related to housing and health. Craig?
Great. Thanks so much for having me here. I just want to say it's a real honor and pleasure to be able to present on this panel with everyone. A couple opening thoughts. First, even though I work at HUD part-time, my views are not HUD's, and so I just want to have that as a disclaimer. I think the other things I just want to lift up to start out with is, one, I think this is a really exciting time to be having this conversation because there's an important role for healthcare to be at the table when thinking about how do we address social needs and how do we move upstream and think about the social determinants of health more broadly. And I think that these discussions are starting to happen and starting to percolate. And so I'm excited to be kind of part of that. And then I think the other thing is, coming from the School of Public Health and School of Nursing, where I primarily do research, that I think there's such importance for engaged research, for research that's understanding and coming from communities that it's trying to serve and lift up policy responses to address the problems that are being shared. So excited that this is part of that engagement.
Thanks, Craig, and looking forward to your comments a little later. And last but not least, I am pleased to introduce Tamika Richardson. Her pronouns are she and her. And Tamika is a state policy fellow at the Maryland Center on Economic Policy. Tamika has extensive housing policy experience from serving on various housing policy committees, including the Baltimore Metropolitan Council Regional Stakeholder Committee and Maryland's AG Farash COVID Task Force. Most recently, she is currently serving on Howard County's first Racial Equity Task Force Housing Committee. Tamika, a few words?
Yes, I'm just excited that everyone was able to come together and that we decided to put this panel on, particularly right now, during a very important time with so much going on with housing in the state of Maryland. And I'm looking forward to hearing what the other panelists have to say, as well as questions from the audience.
Thanks, Tamika, and to all the panelists for being here today. Thanks to, of course, METSEP. I'm so grateful to have the opportunity to moderate this panel because this is such an important topic. First, I think the place to start with today's conversation is to talk a little bit about why access to safe, affordable housing is linked to better health. Dr. Pollack, what does the research show about the links between housing and health?
Great, Siobhan, thanks for opening up the conversation this way. I think that there's so much research going on in this space, and I think it's a really growing area. Mikkel, would you be able to share the slide? So I use this slide in this framework that's by Laura Taylor that was published in Health Affairs. I can put the link in the chat later on. That I think this is a really simple, nice framework to kind of give a brief overview. It's simple recognizing that these are different things that we're going to talk about are all interacting with one another. Here it's kind of oversimplified in ways that I think are helpful. So there's 4 different pathways that she talks about. The first is a pathway that describes the stability of housing. So, the issues that Healthcare for the Homeless works on around chronic homelessness, and as well as many other issues that are also in their purview, and so many of us on the phone work on around other aspects of homelessness, such as couch surfing, doubling up. I know we'll talk about evictions later on in this session, and so that's another sign of the stability pathway. Each of those, the chronic homelessness, the couch surfing, the doubling up, is associated with health in different ways for adults and children. The second pathway is that relates housing and health is around the quality and safety of housing. I think lead paint is kind of first and foremost in people's mind, but there's many other issues around the quality and safety of the housing, such as leaks, poor ventilation, dirty carpets, pet infestation, temperatures, and crowding, and the like, that are all related to health across the life course. And some of those can be for specific populations when we're talking about, cockroach and mouse exposures and allergens and asthma exacerbations in Baltimore City as another example. The third pathway that's brought up here in this framework is around housing affordability. I think this is best demonstrated by the saying, the writings of Matthew Desmond, where he said the rent eats first. And I think that's so sadly true, where people are budgets are stretched very thin due to high housing costs, and that what it leads to is people cutting back on their healthcare spending or health promoting spending in really important ways. So some of that can be directly for healthcare, not going to the doctor, missed doctor's appointments, missing your prescriptions due to cost, but also, not having the time and resources to eat healthy foods, to exercise in ways, or, other things that we know are strongly associated with health across different groups of individuals. And then the last pathway that I just want to highlight, where there's strong and growing evidence, is around neighborhood conditions, and how do neighborhood conditions impact health and well-being. We know that homes are not like isolated in and of themselves; they're part of a broader context and community, and that community can have access to different health-promoting resources, as well as different harms, such as exposure for pollution and the like. And so each of these 4 different pathways, of course, are related to each other, right? Like affordability is going to be more of a problem in some of the neighborhoods that might be more health promoting. But recognizing that each in and of themselves can also have important implications for how we think about health, recognizing that we also need to really take an important life course perspective here, that we're talking about health of children, health of adults, especially health of older adults as well, that each can have differential impacts when we're thinking about how to promote safe and affordable and stable housing for members across our diverse communities.
These are some great points. I think from a health system standpoint, we tend to focus on the affordability and neighborhood pieces of it and try to address from that perspective. But I appreciate the addition of the stability and quality and safety considerations as well. Joanna, your organization provides healthcare to people who are unhoused or in unstable housing situations. What ways do you see housing challenges affecting your clients' health, and how would improving housing access help?
Thank you so much for the question. Yeah, as Healthcare for the Homeless as an agency is a provider of integrated health services and supportive housing for individuals and families experiencing homelessness, we do see firsthand the impacts of unstable housing on a person's life. And I think Dr. Pollock's discussion of the health impacts of chronic homelessness and unsafe housing conditions are spot on, and certainly how the various housing related pathways impact health. And indeed, we have seen in our clients that poor health is already a cause of homelessness, and simply being without a home is a dangerous health condition. People experiencing homelessness have higher rates of illness and die on average 12 years sooner than the general US population. And this is the reason why we have an entire permanent supportive housing team that is integrated and part of the healthcare we provide. Housing is unequivocally healthcare itself. Homelessness occurs because of the disinvestment in affordable housing. We haven't been here always. There have been very deliberate policy decisions that have disinvested from housing over the last number of decades, and we need more resources, very simply, to create and develop more affordable housing and to keep people safely housed. This means a clear investment at the local, state, and federal levels of the development of affordable housing. And in particular, there is an absolute dearth of any resources in terms of affordable housing at the state level. Very, very few. There are a couple different policy mechanisms that we've been using, but certainly at the state level, we can do better. It also means higher wages, and it also means decriminalizing homelessness and decriminalizing poverty and all of the charges associated with a lack of income, charges that stem from people simply trying to survive. Focusing resources on supportive services, eviction prevention, treatment for substance use, case management, peer recovery services, much more. These are the policies that our state needs to prevent and end homelessness. Homelessness is not an intractable problem. We know the solutions, and now we simply have to pass and implement those solutions. And there are several of them that I'm really excited this discussion will uncover today.
That's really helpful. I know that our system also does some work on eviction prevention based on community feedback on what's needed. I'm going to shift our conversation a little bit to kind of COVID's effects on housing. The last year has brought significant new challenges to housing affordability and access, as hundreds of thousands of Marylanders struggled with the economic impact of the COVID-19 pandemic. It's reported that 30% of Maryland households with less than $50,000 could not pay their rent last month, and about 10% of those earning $75,000 couldn't pay their rent. These challenges are not shared equally, as 36% of Black households reported difficulty in paying their rent, compared to just 14% of white households. This data suggests that communities with larger Black and Latinx residents will be hit harder by the upcoming wave of evictions. Ashira, can you tell us about the people you work with and the experiences they've faced in the last year?
Absolutely. So, I'll preface everything by saying Eastern Shore Wellness works with primarily Black and Brown communities, although we are here to serve, all members of the Dorchester County area, along with our neighboring counties. So even in all of that, we've uncovered that about 82% of the individuals that we work with that participate in our programs and services are within the lower income bracket. Most qualify for some sort of social assistance or supports. 91% of the program participants and individuals that we work with in our community are minority. So they come from these Black and Brown communities, with only 33% of Dorchester County's total population being minority. So that number in and of itself is, is pretty phenomenal. But then when we look at some of the other information, 76% of our the individuals that we work with are living with chronic conditions. Another 34% are living with behavioral issues. So it could be, suffering from anxiety, depression, or other mental health issues or concerns. So, we have a large number, a large percentage of our population that is in need of additional supports. And so our systems here in Dorchester County have fallen short of providing those. We do have two small homeless shelters here in the county. We're dealing with a large food insecurity issue, but when it comes to housing and how it has been impacted by our pandemic that everyone seems to be suffering from, we're looking at a population here in Dorchester County that is 44% renters. We only have about 36% that are homeowners. So the majority of our population are renters here in the community. Of that 44%, 30% are from our Black and Brown communities. And so looking at that and having some of the restrictions eased here in the community and across the state, we're looking at higher eviction rates currently. So right now we're looking at about 9%. We are dealing with calls coming in on a regular basis of people that are in need of those supports, whether it is moving them to transitional type housing in the community, working with our landlords to do some more work with quality housing, and working with our Habitat community to get more of the housing available at a more rapid pace for our citizens here. So, we're looking at, like some really interesting facts and figures when it comes to dealing with our Black and Brown community members here. But when we're looking at our residents and population at a whole, it is staggering looking at, like what we have to do, the work that needs to be done, and what's currently being done under the pandemic.
Oh, that is overwhelming. I think that when people think of the Eastern Shore, they can't imagine that the numbers look as they do. This idea that 91% of the people that you're dealing with are underrepresented minorities. I think on the Eastern Shore, people tend to think of rural white communities instead, but not realizing how this is really hitting the underserved minority groups on the Eastern Shore as well. So thanks for
and
that.
If I could just add one more thing, we're also dealing with a large incarcerated population. And so that has always been an issue, making sure that once they go back to reentry into our communities, that they have, housing available and those resources and services available to them. So that is also a concern when we're talking about housing and making sure that they're able to reenter the community safely, not just for themselves, but for the community around them. Yes.
Agreed. So this year has also brought a lot of changes to housing policy. Tamika, can you give us an overview of how federal and state COVID relief efforts so far have tried to address the housing crisis?
Sure. So I'll touch on it kind of twofold ways. I'll go over some funding as well as some things that happen on a state level policy-wise as well. So just a quick overview. I know a lot of people still are not aware that Maryland, we never really did have a eviction moratorium in place. So there are evictions still taking place, and they have been taking place since the pandemic has started. And in fact, even with the CDC order being in place, there's been kind of an increase in kind of what we would call tenant holding over cases, which is where, the tenant may be paying rent, but for whatever reason, the landlord decided they didn't want to renew their lease. So there has definitely been an increase in those cases as well across the state. And then I want to say about, because that's another thing too, I got a question about with late fees and rent increases. So we did have a ban on late fees and rent increases that expired back in July of last year. So that is no longer in effect, along with the CDC moratorium, which we didn't really have anyway, because of Governor Holder, how he kind of interpreted the law. As far as funding goes, this year, the state did get roughly $401 million, and that's, has been already divided up amongst the jurisdictions. I do have some numbers, but I know one of my colleagues is going to put a link in the chat, so I don't want to bore you too much with numbers, given the time constraint. But as far as the direct aid that's going to be going to 8 counties in Maryland, it's going to be about $143 million going to 8 counties. in Maryland, and those will be targeted to households that are at or below 50% of their area median income. Kind of on a state level policy, averaging wise, as far as this funding is going, there's been a lot of work just around on a grassroots level, just to make sure that this direct funding is going to households that really need it. So, for example, I know that's been talked about just making sure that this assistance is going to communities that have been most impacted by COVID, you know, and trying to reduce the paperwork and things that's needed to apply for such assistance as well when it comes to that. Okay, and then as far as the housing justice package, again, going kind of backwards to some bills that have passed, well, trying to get past this legislative session, we didn't have too much luck, but there were 5 bills that MEDSAP did support for this session, and unfortunately only one passed, which was the right to counsel. However, that was kind of passed with no direct funding stream, but still passed, not at least. Some other things that didn't pass that kind of would have helped kind of the housing crisis and kind of help kind of alleviate some of this eviction or mass eviction that people are expecting or anticipating, I should say. Whereas one, kind of helping with eviction filing fees. I believe I had did another blog where I talked about how, for example, in Baltimore City, there are more eviction filings than there are rental households. This kind of alluded to, you know, landlords doing multiple filings. We also had like an eviction diversion program as well that would have required kind of mediation and things above and beyond what's already currently offered that also didn't pass the session, as well as additional eviction protections to kind of bring back in the non-renewal clauses and prohibiting late fees. None of that stuff got passed this session, but hopefully we'll be able to see some kind of tread for next year.
Well, obviously a lot of work still needs to be done, but we appreciate the work that you've done in pulling together some of this policy information so that folks who do want to help educate policymakers or work with MEDSAP to educate policymakers can do so and know kind of what's out there and what's on the table. A federal district court vacated the Centers for Disease Control, the CDC's order, temporarily halting evictions. This is deeply troubling for the nation, especially in states that have yet to issue their own emergency eviction protections. Craig, what are the immediate and long-term health effects on families forced to leave their homes?
Great, thanks for that question. So, you know, I think it's really important to think about why the CDC put in place the order. Like, why was it coming from the CDC? And really the rationale there is a public health rationale, with the idea that eviction moratoriums can help stop the spread of COVID-19 for all the reasons that you and I kind of know at this point of the pandemic, that evictions can lead to people losing their house. And that doesn't even need to be you know, evictions that are actually executed. Some people get a notice and leave their home before actually having the filing in the court and kind of going through all the steps of eviction. There's doubling up. It's harder if people get sick to you know, to remain isolated, remain quarantined. For people that are worried about eviction, they're more likely to go to work when they're sick. You know, there's so many different ways that eviction filings can lead to the spread of COVID-19. Can you bring up the slide if you don't mind? And so, kind of working with some of my colleagues, especially Kate Leifheit, who is now a postdoc at UCLA, had done her PhD work at Hopkins, we were trying to give policymakers some evidence. So I'm going to take a second to talk a little bit about the study that we did on this. And basically, what we did was we looked at, you know, all states kind of in March, all states that were going to enact these statewide moratoriums on eviction. They tended to enact them pretty quickly, but the timing of when these were lifted ended up being pretty variable. before the CDC's eviction moratorium at the beginning of September. So what we did was we leveraged the timing of when states lifted these eviction moratoriums to kind of look at what happens in states where the moratoriums remained in place versus those where the moratoriums were lifted. And we adjusted for a ton of other factors in these analyses to try to get at, like, it's not just the incidence of COVID-19 in the community, it's not just the case rate, but it's these other factors. And so here you can show, along the bottom is the week since the eviction moratorium was lifted, starting at 0, kind of going back, there's really no difference in the case rate between states where the eviction moratorium is lifted versus those where they remained in place. But afterwards, on the right-hand side, you can see that as time progresses, the rates of cases in this case, or the rates of death, increase in states where the moratorium is lifted compared to those where the moratoriums remained in place. So what we estimate from these different models is that it led to about 433,000 excess COVID-19 cases due to states lifting their eviction moratoriums. And troubling, incredibly so, there were about 10,000 excess deaths due to the lifting of the moratoriums. At least that's our best estimate. So this type of data has been used by the CDC and used by different states and advocates to try to make the case that eviction moratoriums really matter. Importantly, I should say here that this was a study of cases within states. It wasn't just looking at the people that were actually evicted and whether those individuals who were evicted were more likely to get COVID and more likely to die, but it's in fact looking at the broader community, because we think that there's really important spillover effects of evictions on the broader community. And that's also been borne out by a lot of other research. So there's a kind of a growing amount of research to suggest that eviction kind of at an individual level has tremendous impacts on the health and well-being of adults, as well as children, right? And that can be children being born to with lower birth rates because their mothers received an eviction notice while they were pregnant, lower rates of food security among children, and also some suggestion that the eviction rates in the broader community can have important public health impacts. And going back to the earlier presentation, we know that a lot of these impacts are really disproportional given kind of the neighborhoods where evictions are more likely to occur, and that it's typically communities of color who experience a disproportionate share of evictions, as well as very gendered in the rate of evictions, with women more likely to receive evictions as well as families.
Wow, that brings into account some of the effects that I think people would never have even thought to look at. I know I'm a little bit blown away by the differences kind of before the eviction, the hold on evictions, and after. That's 400,000 excess cases and 10,000 excess deaths is a lot. I think wow, that's a little overwhelming. Now we'll continue to take questions from the audience in a moment and start answering those. So please go ahead and continue submitting your questions for the panel in the Q&A section. But first, I want to ask each of the panelists to share 1 or 2 policy changes that you think are critical to both meeting the moment and addressing the housing crisis, which has been exacerbated by COVID, and making long-term progress toward a future where all Marylanders can have a safe, affordable housing. I'll start with Joanna.
Sure, thanks so much for the question. I'm sure just in sort of knowing the panelists, getting to know them a little bit, I'm going to agree with them on all of their policy solutions. So there's just like one in particular I'd like to highlight. And I had mentioned earlier an investment in supportive housing, and there is a policy mechanism just for that I'd like to throw out to the audience, and that is the expansion of the ACES Medicaid waiver program. Without getting into too much weedy detail, Maryland Medicaid must apply to the Federal Centers for Medicare and Medicaid Services, so CMS, in order to provide services outside of sort of the very specific narrow scope of services that CMS generally funds. And these programs would generally demonstrate the outcomes of furthering the mission of providing quality and cost-effective healthcare to Marylanders. And one such program is known as Assistance in Community Integration Services, so the ACES pilot program that I wanted to talk about just a little bit. And ACES provides case management support services and housing case management services to individuals with complex healthcare needs who are at risk of homelessness. We at Healthcare for the Homeless are a service provider for ACES. And we assist participants in connecting with healthcare and social service providers and supporting our clients with medical needs in their home. And so in recognizing housing as a key social determinant of health, as we've talked about earlier in this program, ACES has not only expanded, so Medicaid has not only expanded that program, but Maryland Medicaid is currently renewing their application to CMS and looking to expand ACES further. In other words, they've seen that the program improves health outcomes for its participants who are our clients. And as a service provider for this Medicaid pilot program, we've seen firsthand the positive health and housing outcomes for our clients in this program. So we certainly wholeheartedly support Medicaid's renewal of their application. And we support it so much that we do hope that eventually ACES will become a dedicated permanent service of Medicaid. And I have a number of other policy solutions, but for the sake of time, I'll stop at that and just throw out ACES Medicaid waiver as a very tangible policy solution that we can get behind.
Well, I think that's a great suggestion. Ashira, I'll go to you next.
So I think I will once again preface this with the fact that there is a disproportionate amount of Black and Brown community members convicted and incarcerated for felony crimes when compared to their white counterparts for the same crime. So, my policy conviction would be the ban the box for housing and making sure that that is not going to be a barrier. And that simply means to, you want to make sure that we want to establish legislation, to make it illegal for landlords or management agencies to conduct a criminal background check or ask an applicant if they have a criminal history before giving an offer of conditional housing. And so if we are able to do that, ban that box like we've done for employment, and making opening up opportunities for our population to, again, be re-entered into our community safely for themselves and for the community surrounding them, that would be a policy that I think we need to get behind. We have seen evidence that it's been successful with some of the employment opportunities that are available. And so we want to continue building that framework around housing so that we give those individuals the same opportunities.
Agreed. Thanks so much for that. Tamika, you're up next.
I think one of the main parts, I had two now. I don't know if I can have time to share two, but I think right now with HUD, and I think it's a really big push right now just to expand housing vouchers, whether it be state housing vouchers or the mobility housing vouchers. I think that's a real need. As we know, like wait lists for those are really long. My all-time goal and wish, I think I got asked that one time, was if we can make voucher programs an entitlement program, that would be nice, but I'll hold my breath on that one. But that would be something that that I would like to see happen, and it's kind of leaning that way, but not nearly on a grand scale that it needs to be to cover everyone that's currently waiting.
Fair enough. Craig, you're next.
I think the recommendations of their committee members are fantastic, and I think I absolutely agree with you, Tanika, that making vouchers an entitlement program. We know right now that only 1 in 4 renters across the country who are eligible for housing assistance currently receive it. So, the the supply definitely doesn't keep up with demand. And I would say coupled with that, we also need to try to increase the supply of affordable housing. So, looking at ways to produce more affordable housing, for example, funding through the LIHTC program or the low income housing tax credit can be an important tool to try to build the supply, and also being really thoughtful about where we build the supply to make sure that we're not concentrating poverty and kind of reifying existing patterns of structural racism.
That's really helpful. Thank you to all the panelists for their input on that question. I'd like to open this up to questions from the audience. And as a reminder, if you'd like to ask a question, please type it in the Q&A box at the bottom of your screen. I know one of the first questions that I have up here is, knowing the hard work in affordable housing and allowing affordable housing in affordable and unaffordable areas has not happened yet, who is working on this as part of their mission? For example, accessory dwelling units, making accessory dwelling units a by right opportunity in every community, and making duplexes, tris, and quads also by right in every residential area as well. Does anybody have an answer or a thought on that on the panel? I will say that I know that in our sphere in the health system world, we tend to do more of the LIHTC deals as kind of the pathway, and so it gets harder for us to do affordable housing work in unaffordable areas because of the qualification. So although we may advocate for this, it's not something that is easy for us to work on. So we're just trying to work through these different pathways, but I wonder if anybody else on this panel has any thoughts. I don't want to put folks on the spot.
I'll just say there are a lot of community organizations that are working on housing issues. It's something that we're looking at now. By no means it's something that Healthcare for the Homeless is at all taking a lead on, but I certainly want to give credit where credit's due and not take credit where it's not due with us. But there are certainly a number of organizations that are working on specific zoning issues. There are a couple coalitions at the state level, Renters United Maryland, and I do a lot of work in Baltimore and in Baltimore Renters United in particular, that we're a coalition that we're a part of. I'm not saying that those coalitions are necessarily doing specifically that work, but there are a lot of members of those coalitions that sort of focus on a lot of those zoning issues, and they are absolutely critical. So I just want to sort of give credit to a lot of those organizations, and I can't list them all right now, but certainly can go on the websites and see it. And I do see someone in the chat that says from Jane Lyons, maybe, that says Coalition for Smarter Growth is working on those issues in Montgomery and Prince George's. So that's fantastic. And if there's anyone here that's working on them in Baltimore City, I know that there are, I just don't want to speak for them.
And Tamika, did you have anything to add on zoning for multifamily units?
Yes, that's what I was going to say. Kind of to Joanna's point, I sit on some of the same committees that she sits on as well. So I do know that Renters United and some of the other organizations she made, too many of them, but a lot of that work, honestly, is kind of being done at the local level, which kind of makes sense because it's the local level and local jurisdiction that's going to kind of have a more say on, their own zoning issues. I will say that's one of the things that Howard County is definitely focusing on and working on as well right now. That's one of the subcommittees in the housing committee is zoning for more multi-family units. And it's like a really, really, really hot topic right here for Howard County. So it's definitely being done on the local level.
I'd like to jump to the question on the ACES program, and what language and tools can we use as community organizers to advocate for a legislative change to make the Assistance and Community Integration Services pilot a permanent solution as an expansion of Medicaid waiver services?
Take that question. I really appreciate it. So as I mentioned, so every 5 years, that Maryland Medicaid has to reapply to CMS for their sort of general application of all of their waiver program. And it just so happens that this summer is one of those years. And so one of the things, the very sort of public advocacy hooks that and tactics that we can take is providing public comments in support of that application, and specifically the ACES waiver program. There is a public meeting to discuss the waiver application. I want to say in the next 2 weeks or so. I can quickly look it up and put it in the chat, but certainly can submit public comments, both verbally and in writing for that meeting, and then also submit those comments to CMS in favor of the application, and can cite specifically the ACES program, which is what we will be doing along with a number of other Medicaid waiver programs. So it's a really tangible and really appreciated ask. And Ann Seacott just put in the chat, May 27th is the Medicaid waiver hearing. And so submitting comments before that, just in support of their waiver, could expand it, both in terms of providing the services and also expanding the program would be fantastic.
So can I just say, I think the ACES program is such an important program and really a national model in how we think about the links with healthcare paying for housing stability services. And so I'm really, really excited about this. I think one of the things I just want to have like a note of caution about is I think that we have a really high standard for our work addressing social needs for healthcare, where a lot of times the standard is that like, well, it's going to save us money in the long term. And I think that that's often the wrong standard that we apply, that we don't apply that when we put someone on dialysis or when we give them diabetes medicines. We do it because we think it's going to help them live longer and better lives. We think it's going to, help them be healthier. And so I think if we set ourselves up for a standard, not that you're doing this, but I just want to kind of put it out there that it's gonna ultimately save the system money. That that might be true and it's wonderful when it is, but I think that it will only get us to like the really high cost, high needs individuals. And I think we need to kind of have a broader coalition where some of these other things are the right things to do because it promotes people living healthier and better, even if it costs some money, but would still be very much cost effective on a lot of the models that we would use for traditional medicine.
Thanks for adding that, Craig. So there's another question that says there's an undeniable disconnect between the actual lived experiences of renters and the perceptions of our state legislators, which was painfully apparent during last session. How can we systematically address in a structured and strategic manner how legislation is informed by the actual issues faced by renters? I think of that, and I think of kind of the ban the box suggestion that Ashira made, the reality of returned citizens as they come back into the system. And kind of tied to that, we have how do we keep the housing justice momentum going? There's been such a large amount of attention this year. How do we keep the pressure on post-pandemic? Ashira, happy to start with you.
So yeah, I think one of the things that we're doing here is we're utilizing our community health outreach workers to be the voice of our community members. And so using those individuals to share the stories, both quantitatively and analyzing the data qualitatively, so that our representatives are aware of the voice of the community. And so once we gather that information, then we're sharing that with our representatives, inviting them to come down, meet with our community members at virtual events, town hall meetings, and making sure that they have a presence here in the community. They're talking to the people, connecting with the residents and hearing that voice, and allowing our community health outreach workers to then be at those board tables and those committee meetings and advocacy meetings and things like that, so that all of that information is shared back and forth, so that we have a dual system where we're hearing the concerns, but we're also sharing those concerns. And when necessary and when applicable, having those renters, community members there to speak on their own and to share their own experiences. And so that's one of the ways that we're able to help start that process here in our community. And then, like to keep that momentum going, we don't want to get into a place where, COVID is, the pandemic is easing up. And so, some of the supports are, like loosened and let go. So we want to continue that process by allowing people to see that even though those restrictions, some of the restrictions have been lifted, the work still needs to be done. These people, our community members are still suffering. They're still struggling. They're still dealing with these issues. Even though, people are being vaccinated, the issues still exist. They existed prior to. It's just that there was a bright light being shined on those issues. And so we want to continue shining that light by having our voices heard, having our people's voices heard, and making sure that they are represented as we are at these tables and meetings and all of those things.
So much for that. Joanna, Craig, or Tanika want to add?
If I can just quickly add, lifting up a comment that was in the chat, and credit where credit's due. Tisha Guthrie, who I'm assuming is one of the people that is asking some of these questions, has been an incredible leader in the state and also in Baltimore City in uplifting the voices of renters. And I absolutely think that renters and tenants' voices need to be centered in these conversations, not just in advocating for legislation and advocating for policy, but at the very outset in creating the policy and the legislation itself. There are a lot of very nuanced issues, and they're issues that may actually seem like they're niche issues that aren't necessarily indicative of larger problems, but they could make a huge difference in the lives of renters and tenants I work a lot in Baltimore City, but also in the state of Maryland. And I absolutely think that centering the voices of renters and tenants at the very outset in talking to our leaders and in making sure that we have mechanisms for tenants and renters to be able to organize and uplift their own voices is an absolute critical piece of making sure that we pass policies that are absolutely meaningful to housing in the state of Maryland and also in our city.
I would agree. At Baltimore Mercy Health and the Community Health Department, all of our activities are community driven, and lifting up those voices in the very beginning and engaging them in the very beginning in these conversations, in these strategy conversations, I believe is also really crucial. Anyone else in the panel want to add?
Yeah, I would just add on to it is important to get the renters involved and having them be a part of the conversation as well. But then I know another topic that was coming up is that a lot of state legislators are landlords themselves. So that doesn't necessarily mean, that they're bad or that's necessarily a conflict of interest, but it kind of had some of us advocates kind of on the front lines, just kind of thinking, kind of going forward, how to kind of market or lobby policies to them where we could kind of gather more support that is kind of landlord friendly and of course tenant friendly to be able to get more things passed through.
Thank you so much for that, Tanika. I'm really conscious of the time. I want to make sure that there aren't any last minute questions that need to be lifted up. Got a limited line of sight, so depending on anyone else on the panel to help with that if I've missed anything. If not, I will first of all thank all the panelists for their wonderful insights. I know I will definitely be using the information that you guys have shared today as we move forward. Oh, I see one more question. How do you factor the safety behind prison jail environments as a form of stable housing for homeless residents? I'll give 1 minute to that if anyone's got a response to that question. And then I will, as I said, thank you to all the panelists, and then I'll turn it over to Ben for closing remarks. I think that's a hard one to wrap up on or to address. Not sure if folks have any experience or in terms of the safety behind prison and jail environments. Maybe this is something that MedSep can look into as a policy, possibly a possible policy initiative, and then we can circle back on that. But I want to make sure, again, to be conscious of people's time and to give Ben an opportunity to wrap up.
Thank you, Siobhan. And that is all the time we have, unfortunately, but really just thank you to our panelists. Thank you to our guests for joining this conversation today, submitting thoughtful questions. Please do stay in touch. You can keep up with the latest Maryland policy developments by following the Maryland Center on Economic Policy on Facebook and on Twitter. You can also sign up for our email list to make sure you hear about future webinars about this and similar topics. So with that, I'll just say thank you again and hope that everybody has a good day.
Thanks, everyone.